I'm Dr. Donald Atkins, and I've been in practice here in San Antonio in a group setting for the last 25 years. I do perform a wide array of spinal surgeries. For a long time, I've focused on minimally invasive approaches to the treatment of spine surgery, and that aspect of things has improved over the last 20 or 30 years. Non-surgical treatments are very effective for the vast majority of spine problems, and the vast majority of spine problems are degenerative in nature. Probably 90% of spinal surgery that's performed is performed to try and alleviate pain, and only about 10% is performed for actual neurologic impairment and dysfunction. Just having these type of degenerative conditions does not mean that you will be in pain from this problem indefinitely. Spinal stimulation therapy is a very minimally invasive type of permanent treatment for chronic pain. It involves placing a pair of electrodes with needles. All this surgery is done just essentially underneath the skin surface. So for a permanent implant, most patients feel pretty normal within 2 or 3 days of their implant. And in fact, we have to sort of place restrictions on the patient for the first month, simply so that their implant will stay put. It's an incredibly safe treatment with a lower complication rate than any other type of spinal surgery, but patients are really able to be productive and in fact work within a few days of having the system installed. Part of why I've been so interested in spinal stimulation therapy and why I've done so much of it over the years has been seeing that technology has improved by leaps and bounds. Our computer systems have improved so dramatically, have led to just markedly increased improvements in outcomes for patients with spinal cord stimulators.